there's a very strong recommendation, maybe stronger from me than from the group, because they're waiting for certain studies. I just want to say, I want to say it like it is. Don't take Tylenol. Let's do it now. I was just saying to Bobby and the group, let's do it now. Nothing bad can happen. It can only good happen. But with Tylenol, don't take it. Don't take it.
That was President Donald Trump on his recent public suggestion that pregnant women should stop taking the painkiller Tylenol, linking it to the rise of autism. The announcement is causing a lot of reaction from some parents and health professionals who say there is no evidence to support that recommendation. Here to discuss it is Dr. Jeremy Veenstra-Vanderweele, a professor of child and adolescent psychiatry at Columbia University. Doctor, thank you for joining us.
Thank you, Dean.
What's your immediate reaction to hearing what President Trump said?
You know, it's painful. This is actually a question that has been studied extensively over the last 10 years, and the evidence suggests that there's no link, and certainly not a strong link, not something that would lead someone to provide medical advice that this shouldn't be taken. It's disappointing, it's reckless.
Where is this suggestion coming from?
So starting about 10 years ago, scientists evaluated this idea that maybe Tylenol could be linked to autism risk. In the initial studies, people tend to ask, is this possible? And in the follow-up studies, people ask, is this true? And in those careful studies, they saw that once you accounted for things like fever, infection, the background of a parent who may be taking Tylenol during pregnancy, any effect went away. And so the suggestion from the more recent data is that there isn't risk associated with autism. Importantly, we do know that fever or infection can be bad for a pregnancy, and high fever that's untreated can in particular be bad and could be problematic for the child's development. So the idea that you shouldn't take Tylenol may be exactly counter to the sort of recommendations that a physician would want to make.
So do we have any idea what the cause is for the rise of autism? Most recently, the CDC reports that the number of children being diagnosed is now 1 in every 31 children. So a lot of families are dealing with this. That's about 3% of all 8-year-old children.
Yeah, absolutely. Thank you, Dean. I appreciate the opportunity to address this. Most of that effect seems to be driven by changes in how we diagnose autism, increased awareness, and you see information about autism everywhere now, and increased screening at the level of pediatricians, which is now recommended to be done for every child starting at 18 months of age. And so that drives most of the increase. Those kids who are more severely affected that President Trump has talked about, Secretary Kennedy has talked about, the rate in autism diagnosis in that group is not nearly as high in terms of its increase over time, suggesting that the kids who are severely affected are about the same rates as what we saw even 10 or 20 years ago. So by and large, this is driven by a change in how we make diagnoses.
Very quickly, I want to get 2 more quick questions in. There's also concerns from the Trump White House about vaccines causing autism.
Yeah, so this has been completely debunked for 20 years now. It is not a logical thing that we are still talking about vaccines in relation to autism. There are so many more important things that we could be talking about, that we could be studying, ways that we could follow up using science to understand those things that are actually connected to autism, like more than 200 genes that have been identified as contributing to autism, such that genetic testing now can identify a contributing gene or genomic region in 15% of kids, maybe even as high as 20% of kids, using technology that we have right now.
And very quickly, what advice do you have for families who have a child with autism, because it can be difficult?
So I think importantly, families need support. Families don't need some concern that's blown out of proportion. What families need to do is they need to connect with their physician, they need to connect with their other care providers, oftentimes a behavior therapist, their teachers, to get support that's specific to their child. Understanding that this is something that may be a distraction and prevent you from taking the time to talk about what your child actually needs.
All right, Dr. Jeremy Veenstra-Vanderweele, thank you so much for your time.
Thanks so much, Dean.
Thank you for watching our YouTube channel. Let Spectrum News be your resource for balanced, in-depth political coverage, and click the subscribe button right here. You can also download our app or watch us on TV to learn more about the candidates, where they stand on the issues, and more. We'll see you then.